It's a story about access, it's a story about women, and it's a story about leadership.
My grandmother died from cervical cancer, and it wasn't found out until it was too late. My grandfather had prostate cancer, so I felt that their health-seeking behavior, and certainly culturally and socially around them, it wasn't something that was easy to discuss because, it revolves around your reproductive health system. So naturally for us as Africans, that's not something we easily speak about.
Africa is a very interesting place to work in, and it's because we are predominantly a patriarchal society. But when it comes to how the community works, women are at the forefront. When it comes to how children go to school, when it comes to how the man is fed, it's the woman who becomes a pivotal part of how the community works.
If you look at the whole continuum of care, from the awareness and the screening part, the most fundamental part, a lot of our women do not understand, first of all, the disease. For example, in Kenya, in the local languages, we don't even have a name for cancer. So you can imagine today if a woman has an issue, maybe a lump in her breast, how does she go and explain that to a healthcare provider? And even how does the healthcare provider understand?
Cancer, in many aspects, is not even something that we understand at that community level. If we talk about malaria, it's very easy, and it only was until recently that we're able to translate cancer to saratani in Swahili, which is still a very deep Swahili word for anyone, say even in Kenya, to understand.
Women generally do not go for screening. The level of awareness is low, and breast cancer and cervical cancer, if detected early, can actually be cured. They can also be prevented if only the women knew what to do.
In Makueni, when the clinic was actually incepted, most of these people used to be terminally ill. Cancer was the number 3 cause of mortality in our facility.
This gives cancer the image of being a death sentence. And personally, I'd like to change this narrative.
When you look at the challenges that the cancer patient is facing today, and in countries like ours, which are the low and mid-income countries with limited resources, governments sometimes struggle to prioritize, especially non-communicable diseases. About 4 years ago, we had a partnership as Roche Kenya together with the Ministry of Health. The leadership felt that it is important for us to reach out to another affiliate to learn what they were doing different, so that then we can also make our partnership better. And so we reached out to the Colombian affiliate, and we worked on a peer-to-peer exchange program to learn how they were working. The market dynamics are very similar in Colombia and Kenya, but they were way ahead of us in universal health coverage. So I traveled to Colombia to meet my peer, who was then head of access and policy, and tried to learn from the internal teams what they were doing, how they were able to ensure that patients were getting standard of care and better therapeutics. That is when I had an opportunity to visit the PINC offices, which was a partnership between the Colombian affiliate and a hospital within a faith-based organization. And of course, with a lot of consultation, both internally and externally, with different stakeholders, we were able to come up with Empower. With County First Ladies Association, which is an association of the governor's wives within the country, and they were to assist us in creating the awareness, especially at the community level. They give people the confidence and trust because they are the face of the government in the communities.
So about 3 years ago, County First Ladies Association partnered with Roche, Women for Cancer, Africa Cancer Foundation, and International Cancer Institute to plant cancer screening clinics for women around the country. And to date, we have planted 14 dubbed Empower. The purpose of this was to bring screening to the doorstep of the communities.
If you catch the cancer early, you're able to treat it early. Now, the good thing is right now we have a dedicated unit whereby when women come for their family planning services, they are able to access advice and screening on the same. So let's say a woman is uncomfortable, somebody doing a clinical breast examination for them, they're actually taught how to do this at home and what to report.
This empowers them. They get to understand what to look out for in their body in terms of discharges and any abnormalities that they may see. So that when they do go to a hospital to see a doctor, they can discuss these things openly. And we also hope that there'll be a reduction of stigma when they realize that this is a common thing. It's okay to talk about it. And of course, we expect that they will share this with other women in the community, because women always share a lot of information with each other.
Na wakati huu nilikuwa mgonjwa, nilisaidia watu watatu. Nikimwambia nenda hospitali waangaliwe. Na mtu akisikia chochote, kimbia uone daktari, wacha kufikiria ati umeroga.
It's so important to invest in women's health. Women are the backbone of society. They are the nurturers. They are the ones who raise the future generation. And if their health is compromised, it compromises the quality of life of the children that they will raise.
One thing that I admire a lot about Roche is that they put the patient first. They try to understand what is a patient going through and try and see then how the innovation solve that problem. We also look at our people internally, because if you build an organization on systems, you're not going to go far. You must build people within the organizations and then they build the system. The stakeholders also felt that we need to go a step further. Now, the similarity between Colombia and Kenya now was that there was a lot of stigma on breast cancer, and a lot of the healthcare providers were men. And what they were doing was using blind community health workers for clinical breast examination to make the woman feel comfortable. And I thought that was a very good idea, because we are having similar challenges in our country. There's a lot of stigma for breast cancer. A lot of our healthcare providers were men. We felt that the patient story and the patient experience needs to be understood and brought in Amref. Now, Amref has come in because they are the largest NGO within Africa, and they are the ones that are responsible for training the community health workers with disability.
My name is Kitawa Wemo. I'm the project lead for the Amref Roche Empower project, which is being implemented across 7 counties in Kenya at Amref Health Innovations. The Empower Amref partnership or collaboration is a flagship type project that works with community health workers who have disabilities, who then use the Empower clinics as channels to reach the communities through community health worker sensitization and activation. So what this means is we'll be able to offer community health worker support using community health workers with disabilities, which is the first to happen in Africa, which makes it complex and makes it exciting at the same time.
We felt that we can include the blind to do the clinical breast examination and the deaf to do the cervical cancer screening. So Amref has come as subject matter expert to train community health workers who have disability and convert the training modules that the government has for this special kind of women.
It's a fortunate accident that we were able to implement this. And this is initially because we were running an accelerator, working with persons with disability and innovators to come up with technology. Now, through this accelerator, we were able to understand that we were missing a very key component, and that's the community. And we're making the mistake that every other program makes, which is designing programs in a boardroom and going to communities to deploy. We decided to become more intentional about the diversity, equality, and inclusion conversation. Famous saying is that diversity is invited to the party, but inclusion is asked to dance. And everyone wants to push forward and say that they're working with persons with disability when they're actually not. So for the core work that Amref is able to execute, which is working with community health workers, we decided to challenge ourselves, and in partnership with Roche that already had these channels, which were the Empower clinics, which is usually the biggest gap, that you don't have health facilities that are ready and willing to have you experiment on something that hasn't been done before.
We people with disability, we have a lot of challenges amongst people who are. Sometimes you can go where people are gatherings They really show us discrimination, as if we disabled people, we are not human beings like them. So that has really touched my heart. But at the time, I lost my hearing since the school I was working at. They fired me because of my deafness. So from that time up to now, I'm not working. My names are Rose and Tessia. I am a qualified ECD teacher, having worked for 16 years. Now, I have 2 problems. Hearing, and my eyes now, they can't see small letters.
I'm Irene Wambui Wamiti from Laikipia County. I'm visually impaired. Sight ndio ilipotea 2013 after nikideliver mtoto.
My name is Penina Kambura. I'm from Meru. I am visually impaired. I lost my sight the year 2010. I was a teacher, still I am, but I had to break service and go for rehabilitation, where I learned how to live independently. I accepted myself. I was able to overcome stigma and believe that I can do things even on my own with minimum assistance.
The rest of the world is moving. The rest of the world is being very sophisticated with how they handle assistive technology because their health and education systems have allowed for persons with disability to participate in the day-to-day economic world. So when you look at how we are able to do this, is we are being intentional in showing first that community health workers with disabilities are able to deliver in the exact same way or even better than persons who do not have disability as community health workers. They show empathy. They have actually heightened senses. So if you're blind, you find your hearing is very good. Your sense of touch is very good. If you lack hearing, you are able to observe a little bit better because you lack distraction to hear other things. So there's a lot more value when you look at how a person with disability fits into the day-to-day way of work.
Sikuwa nafikiria naweza enda kufanyiwa training kama hiyo na niweze, juu nilikuwa naona mtu visually haezi fanya, lakini kulingana na venye tumetrainiwa nimeona niko able na naweza fanya. Sasa nikiwa CHV sana sana sitakuwa daktari, nitakuwa daktari wa huko mashinani. Kuna fomu ambayo nitakuwa nikilifaa watu MOH 100 unalifaa client. Nilisoma mambo na kansa, tulisoma kansa ya breast cancer, cervical cancer, prostate cancer. Kama kuna mahali ana uvimbe unafaa umuelekeze kwa daktari aende afanyiwe test ndio ajue, sababu unaweza kuwa na uvimbe na pengine si kansa. Venye tutakuwa tukifanya counseling, kuwapea motisha, kuambia kama uko na kansa si mwisho ya dunia. Watoto under 5 years tukasomeshwa mambo ya venye tutakuwa tukitunza hao watoto kutoka mama akiwa mjamzito, venye watakuwa wakienda clinic, kama amepata challenges ama anaona kuna complications anakimbia kwa madaktari. Venye mtu akiwa akona stigma unapata mtu ako chini, venye utamuongelesha na ndio niwaelekeze. At least niko na kitu nimesoma sana ambayo siku anajua, na tunaona sasa tukienda huko, hata tukitumwa huko kwa community, tutaenda na tuelimishe watu wetu.
Lack of knowledge is the main problem, because if people have knowledge, they can change their life standards.
Nini training ili consist many things in human beings' life. Tulifundishwa about hygiene, community health, things like COVID-19, also HIV and AIDS, family planning, many things concerning health.
And this particular project is being executed by the Innovations Business Unit because of the technology aspect. So as opposed to just running the trainings in a one-on-one kind of setup, then we have built technologies, specifically Leap Smart, which is used for capacity building of training the health force. And then we have MJali, which is a data collection and management tool. And these two then come together to inform any health interventions, inform any policy that might come out of projects that we're able to run.
A lot is working based on engaging the county referral hospitals. I feel lucky because of what we've also learned on the ground. We brought a women's issue to the county governments. Now it's not a women issue anymore. Women, men, and children can get treated in those cancer centers. So bringing a women issue has become now a community issue.
Initially, there was no cancer clinic in the whole of Taita Taveta County. Now, care is close to home, it's close to family, so that translates to better outcomes. There is no loss to follow up, and that will translate to more cure rates.
Hata mimi inanisaidia sana na ninashukuru sana, na kile naweza kusema kwa serikali iendelee hivyo hivi na wahurumie watu wa saratani, sababu kuna mtu ana chochote.
When we are paying for healthcare, it needs to be as simple as buying airtime for your phone. It doesn't have to be complex. Health is a right. Health is a right for everyone, and everyone has a right to access the right form of healthcare. Healthcare needs to be affordable, it needs to be accessible, it needs to be inclusive, it needs to be equitable for everyone. So this is the SDG that we want to target, that good health for everyone in sub-Saharan Africa as a start, and hopefully we are able to partner with more governments, more organizations across the world that share the same interest in building a sustainable world for health.
I'm a firm believer that the first thing that we have done is to have the courage to be different. Courage to take the first step. Because in terms of awareness, it is there. But nobody is willing to take that risk to put an activity in place for people with disability.
Sana sana kama mimi nikisimamia watu wenye wako visually impaired, juu hawakuwa wanaenda mahospitali walikuwa wanaogopa. Sasa venye nimetrainiwa, nitakuwa na ile knowledge ya kwenda kuongea na wao na kuambia kwenda hospitali ni kwa maana na ndio waende watibiwe.
After losing my sight for a season, I felt like my life had come to an end. Despite my challenge, I can be a community health educator and pass the knowledge to my community.
Experience yangu ni kuwa nawapongeza kwa kushughulikia haswa walemavu na afya yao, kwa sababu Kenya hii yetu ni watu wachache sana utakuta kuwa anashughulikia watu ambao wako na disability. Nimeona tangu nipata na hii shida wamekuwa support sana kwa maisha yangu na walemavu, so waendelee na moyo huo. They have shown me love. We don't clap. Our clapping is this. Thank you.